Morning, everyone. This is Alex Ehsan. I'm a medical oncologist. I've been treating cancer for over 2 decades. Today, I want to talk to you about two cancers that many people have never heard of until someone they love is diagnosed with it. One is gallbladder cancer, because we always think about an organ that you get rid of it when it stops working. The other one is bile duct cancer, also called cholangiocarcinoma. And although these cancers are uncommon, I have seen many of them, and they can be very serious because they often grow quietly for months before causing any symptoms. And luckily today, we have excellent treatment options. And I want to tell you about a recent patient of mine, 63-year-old grandmother actually, who was having what she called gallbladder attack. She was having this attack come on after eating, some nausea, bloating, nothing really severe. One morning, her husband noticed that her eyes were looking more yellow than usual, and her daughter noticed that she was itching more, but they kind of thought it had to do with poison oak or poison ivy because of working in the garden. She told me that her urine became more dark, her stools became more pale, which is really telltale signs of this. When I met her, she asked me, Doctor, is this cancer? And the answer is yes. The gallbladder is a small organ beneath your liver that stores bile. The bile ducts are tiny tubes that carry the bile to the liver into the intestine for digestion of fats mainly. It could occur in either location, uh, but keep in mind gallbladder cancer uh, could sometimes even be discovered after you take out your gallbladder because you just have a bad gallbladder. So the symptoms can be confusing, and so if you're having any of these issues, you need to definitely check with your doctor. Uh, I have seen it more often in patients who have chronic inflammation of the gallbladder, typically because of long-standing gallstones, certain bile duct diseases. Uh, One of the fancier one is a primary sclerosing cholangitis, or even cysts can cause this. I've had patients with liver flukes that moved to US, and then I saw them and they had gallbladder cancer. And diabetes, smoking, and obesity, and all of these things can definitely cause it. But unfortunately, there's no obvious risk factor that I can tell you. What do you look for? The changes in the color of the skin, the dark urine, when you start noticing that your stool is becoming light in color, pain in the right upper quadrant, feeling full, not wanting to eat your favorite food. And when you have blocked bile ducts, uh, you may have a yellowing of the skin, or itching, or yellowing of the whites of your eye. It typically starts uh, really in a very quiet manner. When you go see your doctor, they do a complete blood count, typically an ultrasound. Some doctors order a CAT scan of the abdomen and pelvis right off the bat. But ultimately, what we need to do is an MRI and what's called an MRCP. This is really a process where the endoscopic procedure called ERCP allows us to put a stent inside the blocked bile duct and allow the bile to run so you don't feel so miserable and itchy and yellow. And depending on if your PET scan shows that this is already in other places, meaning it's already gone to the lung or the liver, or not, then we can aim for surgical resection and hopefully cure of this cancer. Now, if surgery is not possible, then we have much better immunotherapy drugs nowadays that improve survival for many patients. We sometimes combine these with chemotherapy. So precision medicine, targeted therapy, genetic testing are very important, and I usually ask my colleagues in the pathology department to submit the pathology report for a complete genetic testing because we do have targeted drugs that we can definitely help you with. Uh, the beauty of targeted drugs is that they are remarkably effective, and that's why the molecular testing has become super important. Uh, and luckily, we can do one biopsy and have an answer and take care of you very quickly. In case of my patient, she ended up having a tumor that blocked the bile duct. She had a procedure to relieve that obstruction and had a stent placed. The genetic testing in her ended up showing as FGFR2 fusion, and she was able to get a targeted therapy. And months later, really, she started living life, traveling, and everything got better. We have kept on following up with her symptoms and checking her PET scans and blood work and everything else. And what I want everyone to know is honestly that there is plenty of hope uh, for this cancer that wasn't there before. Surgery is quite successful. Molecular testing is very useful. And definitely go to a center where treating biliary cancers is what they do. My mission really is to help patients and their families understand cancer in plain language while bringing you honest, non sugar coated hope. Uh, and like I said initially, if you have a relative that needs help, please convince them to go to the doctor. If you're already my patient, look forward to seeing you soon. And if you're not, hopefully you never need me and we never meet. Best of luck, and I'm glad we had a chance to spend some time together.